Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. It's the leading cause of cancer death in the U.S. Not breast cancer, not pancreatic cancer, not colorectal cancer, it's lung cancer. An estimated 235,000 Americans will be diagnosed with lung cancer this year. While West Virginia has the highest adult smoking rate in the country and the second highest rate of new lung cancer cases, the lung cancer survival rate is improving significantly in the Mountain State. It's Lung Cancer Awareness Month, so today we're talking about lung cancer prevention, diagnosis, and treatment with Dr. Kyle Chapman, pulmonologist at the WVU Cancer Institute. Welcome, Dr. Chapman, to Live Healthy West Virginia.
Mary, thank you for having me. I'm excited to talk today.
Yeah, we've got a lot to cover, too.
Yeah.
Yeah. So let's start with, we mentioned some statistics there at the
Sure.
top of the show. I mean, lung cancer is obviously a big issue across the country, but it's really a problem here in West Virginia, isn't it?
Yes, I agree with that. So West Virginia has a lot of challenges when it comes to the health of the public, but as you mentioned before, number one state in smoking. I'd love it if that wasn't the case,
Yeah.
but it is where we are. And so not surprisingly, a lot of cases of lung cancer. So it's a common problem in West Virginia. From our West Virginia Cancer Registry, we know that every year over 2,000 people are diagnosed with lung cancer just in the Mountain State.
Wow.
And I think a lot of the challenge around it is about half of the time we're diagnosing it when it's already spread. It's at a metastatic state. And so the survival outcome for stage 4 disease is pretty poor. But when we're able to catch it at an early stage, so it's localized, maybe limited to a single lung or definitely still within the chest, then that survival rate's a lot better. So a lot of the challenge around lung cancer is detecting it at an early stage where we can talk about potential for cure.
Early detection's everything, isn't it?
It absolutely is.
So have we dug too deep of a hole here in West Virginia? I mean, or are we slowly heading in the right direction?
I think there's some reason for optimism. I think we've seen some progress, certainly in the last 5 years. Most of that and the work that I do is in cancer prevention with early detection through lung cancer screening. So lung cancer screening is not where it needs to be, and I think there's reasons for that. But we've seen significant growth in what we're doing, particularly through WVU Medicine and the Cancer Institute and our outreach. So our early detection rate and the number of cases that we're detecting at an early stage is improving over the past 5 years.
So when you said it's not in the best place, where are we with lung cancer screening?
Yeah, the estimates are somewhat difficult to nail down because it's not just something where it's like at a certain age you get screened for lung cancer. It's an age plus a specific amount of tobacco smoke in your past. So that number isn't always captured by census data, so we only have estimates of what the true eligible population for screening is. Even with the most generous estimates, we're screening less than 20% of the folks that would be eligible for screening. In contrast, if you think about things like colorectal cancer screening or breast cancer screening, there's just a much bigger public awareness of it. And so those numbers are 70 to 80% or above of patients that are eligible getting screened. So with lung cancer screening, we still have a long way to go.
All right. Well, we're going to change that today, right?
I hope so. Yeah.
So before we go into the details of screening, how can people reduce their risk of developing lung cancer?
Yeah, that's a great question.
Prevention in the first place, right?
Yeah. So as great as the technology is with our low-dose CAT scans and lung cancer screening, I think by far the best way to decrease the burden of lung cancer is tobacco cessation. It's easy for me as a pulmonologist to preach, hey, cigarettes are bad for you, but the truth is it's much harder to just stop smoking. And so I think that is part of the challenge of the health system is helping people and not necessarily passing judgment, but meeting them where they are and then providing them with the resources to quit. And what I tell folks in my clinic all the time is it's hard to quit, but let's set some reasonable goals. If you're smoking a pack a day, next time I see you in clinic, I want that to be 10 cigarettes, a half a pack a day. And is that a realistic goal? Work with them through that. Other things that we have a lot of tools that we sometimes underuse. There's nicotine replacement products. A lot of those are available over the counter. And then there's prescription medicines too that can help decrease cravings. So it's not one approach fits everyone. It really needs to be a kind of a tailored thing between the person and their provider.
Do we still have that quit line?
There's the 1-800-QUIT NOW is the free quit line.
Okay, so there are a lot of resources out there.
Absolutely.
You should probably talk to your doctor or just call that number.
Yeah.
Okay, all right. We were talking about, late stage cancer. That seems to be when they're most detected. I mean, what are the symptoms of lung cancer? Are the symptoms just showing up too late?
Yeah, that's another one of the big challenges around lung cancer. So if you think about someone coughing up a bunch of blood or losing weight without trying, usually that's not something you're going to see in an early stage. Early on, you may not have a lot of symptoms at all. So it can present as cough or night sweats, coughing up blood. All of those things are concerning. But part of the challenge is usually when you're seeing these symptoms, it's already at an advanced stage. So early detection is often done before there's any evidence of symptoms.
Okay, so let's talk about the screening. I mean, there's so much available here. And it's okay if you're still smoking to go get screened, right?
Yeah.
No shame.
Yeah, no, absolutely. And I think some of the messaging around it has been mixed. I know that there have been billboards in Morgantown I've seen driving into work that said, "You've quit smoking. That was the hard part. Now do screening." And absolutely, we want to screen people that used to smoke, but you're eligible for screening even if you still smoke, and it's still a time where we can help.
Okay, so talk about the low dose screening program.
Sure. So I'll start with the basics of eligibility. So This is intended for people that either currently smoke or quit smoking within the last 15 years. And there's a medical term called pack years that has to do with how many cigarettes you've smoked in your lifetime. That's not something I expect people to figure out on their own. But if you're between age 50 and 80 and aren't having a lot of active symptoms of lung cancer and have that smoking history, that's who's eligible to be screened. Because it can be a little bit complicated, my message would be, if you think you're eligible or you're curious about it, by all means ask your provider and they can help figure it out.
Yeah. And then what do you do after you talk to your provider? And how often do you go for a screening?
So kind of the nuts and bolts approach of it is you talk with your provider, you decide, does this screening test make sense for me? If yes, they place an order for what's called a low-dose CAT scan. Low dose means it's less radiation than a traditional CAT scan, and there's no IVs and there's no contrast, so you don't have to worry about that. Once the order is placed, someone will call to schedule. It usually doesn't take a long time to get folks in. We do screenings every single day. The procedure itself is painless. There's nothing to it. You go, you complete the registration, you lay down. The CAT scan itself takes a minute.
Wow. And it's you guys make it as simple as possible, right? Does insurance usually cover it?
Yeah, that's a great question. So it is covered by all major insurers, including Medicaid and Medicare.
Great. So that's how the screening system works and how to get it done. You mentioned earlier that the lung cancer screening rates are really low. I mean, we've got this program, but we're not screening nearly as many people as we should. Why do you think that is? Why? Yeah,
so one thing that I'm hoping we're addressing today is low public awareness, right? I think a lot about if you go to an NFL game at a certain month, the entire stadium's in pink, right? They're promoting breast cancer awareness and screening, and that's wonderful. But we just don't have that kind of recognition for lung cancer screening. So I think some of it is low awareness in the general public. Hopefully that'll get better over time. I think it's a relatively new screening intervention. So I think on the provider side, that's another challenge is a lot of people out in the community say, this wasn't a thing 10 years ago, so I don't know about it. I don't know if the risks outweigh the benefits, and then they just don't think about it. So I think there's a lack of provider awareness. But the other important element that I would mention is stigma, right? If you ever talk to friends, family, and they say, oh, did you hear so-and-so had lung cancer? And it's almost always followed up with, well, they were a smoker. So there's this stigma of it's a self-inflicted harm, and it just isn't talked about the same way as breast cancer or colon cancer. But I think the challenge there is we still want to screen these folks. We want to help everyone. So whether they're actively smoking or quit in the last 15 years, if they're eligible, we want to get them in. We want to get them screened. We want to do it because we think we can help.
And it's a real strong addiction, isn't it?
Oh, absolutely.
Yeah. How common is it? This was my question I wanted to know, because I know this happened to a few people. How common is it for people who have never smoked to get lung cancer?
So it does happen. Anyone that has lungs can get lung cancer. When we think about the biggest risk factors, by far in West Virginia, smoking is the number one cause. So from our West Virginia Cancer Registry, every case of diagnosed lung cancer, we looked at that data. 90% of all men with lung cancer had a strong smoking history. 80% of all women had a strong smoking history. Now, that still leaves a lot of people that end up with lung cancer that didn't smoke, but usually there's some secondary risk. Either maybe they worked in an environment where there's just a ton of secondhand smoke around, or they had some occupational risk where they were around asbestos or silica dust. The other common thing that we don't talk about or think about a lot is radon exposure. So when was the last time you thought about radon? Probably in the context of buying a new house.
Almost never, yeah. But you're right, when we bought a house.
Yeah, so it's a odorless, colorless gas. It's something that if you're concerned about your radon exposure, you can actually get free testing kits from the Department of Health and Human Resources from the state. Unfortunately, we don't have a good pathway to screen folks that have never smoked for lung cancer. So the current screening guidelines really focus on that smoking history. But I acknowledge that you can avoid smoke and still get lung cancer. It's just much less common.
Okay. Wow. When we were talking about screening, you were talking about the stigma, but I bet you run into a lot of, wow, I'm afraid. What if they find something?
Yeah.
If I don't go, they won't find anything, right?
Yeah.
How do you convince people to get over that?
Yeah, I think it's part of the discussion when I'm seeing a patient in the clinic and I'm talking to them. We call it shared decision making. So we're saying in advance, if we find something, here's exactly what we're going to do, and we'll do it together. We'll figure it out. So I like to imagine screening as part of a continuum of care when it comes to lung cancer. So screening early, hopefully we don't find anything. If we do, I want to see that all the way through diagnosis, treatment, and cure. So lung cancer screening is an imperfect test. It's great at picking up lung cancer, but we also find a lot of other things. So I can speak to some of that experience. We're really proud of the work we've done with our mobile screening program.
Yeah, Lucas, right?
And we, even though we've only been on the road for a few years, we've diagnosed over 80 cases of cancer. Of that, only 72 were lung cancer. So because it's a CAT scan, it's not specific to the lungs. We've found thyroid cancer, breast cancer, pancreatic cancer. And at the end of the day, those are still lives saved. We did the test to look for one thing. We found something else, but we still had a meaningful impact.
So tell us a little bit about Lucas and, how this works.
Yeah, so
another way to make it easier to get screened.
Yeah, so when it comes to lung cancer screening, what we found is it's a barrier, right? Because historically you had to go to a hospital setting. For me, working in an academic center, it's not a big deal. I can say, hey, next time I see you, let's do this CAT scan. It's in the same building where I have my clinic. But there's a lot of folks in West Virginia where Morgantown is a long drive. And so the idea of taking time off work to go get a CAT scan and driving back and forth, that it's not nothing, right? It's a significant time and cost to do that. And so we really identified that transportation was a major barrier for a lot of our patients. So one of the things I'm really proud to be a part of is our Lucas program, which is our mobile lung cancer screening. We were the first program really in the United States to be completely fully mobile. And it just made sense going to where people are. If you ever see it, it's a big tractor trailer is part of it with the CAT scanner on it. We've got a great team, and there's actually a second truck that follows behind it that brings a generator so that we are not dependent on power. And it's sometimes hard to find a level parking space in the Mountain State, But we've done screenings all over the place, parking lots outside of clinics, fairgrounds, you name it, and we've probably done it. So Lucas intentionally goes to places where there is no access to this low-dose CAT scanner. And we partner with providers throughout the community, and it's been really cool. Since we launched Lucas, in comparison to our stationary program here in Morgantown, really within 2 years, we were matching similar volumes. So the number of people we were screening in Morgantown, either at the University Town Center or at Ruby, has really been matched by Lucas within a year or two. And those are folks that we're not necessarily diverting away from coming to Morgantown. We're meeting them where they are and doing screening, and otherwise they just weren't getting screened.
Wow. I mean, it is a fabulous program. Now, but let's make it clear, like if Lucas comes to your town, you can't just walk up and say, hey, give me a screening, right?
We're not quite there yet.
Okay.
So usually how it works is we will meet with a primary care office in the area. We'll explain to them, these are the benefits of lung cancer screening. Here's who's eligible. And then we'll say, do you think you have a number of patients interested? And that number we like to see is at least a dozen. And then if so, we say, okay, we'll pick a date on the calendar and we'll go there that day. The provider will order the scans in advance so that we can get insurance to cover it. And we are very successful with that. Insurance has been great working with us with Lucas. And then patients show up on that day. We've had patients tell us they come right before their shift starts at work, or they come on their lunch break, and it takes just a few minutes. So that extra level of convenience has been really meaningful. Time and again, they've told our team, if this weren't here in my hometown, I would never have done this screening.
Yeah. It's painless, right?
There's no pain involved.
Yeah. So as far as Lucas is concerned, I think this gives us, I mean, what else? We've got the CT scans. Oh, I didn't ask you, how often should you go for these screenings?
Yeah, that's another important element of it. So a one-time screen is good if you have good news, but it's not the whole story. So it is an annual screening, and 90% of people that get screened, that's going to be the recommendation, is come back next year and continue to do that. So over time, the idea is if a scan is normal, great, but you're still at some risk of developing cancer in the future, and we still want to catch it early. So it is an annual low-dose CAT scan.
Okay. And insurance covers it on Lucas as well?
It does, yeah.
So it's the same thing. We're just bringing the scanner to you.
Right, yeah.
That's what an excellent program. So we're pretty hopeful about lung cancer treatment here in West Virginia. I mean, I know it's been slow, but are we heading in the right direction? What signs of improvement do you see? Give us something to be hopeful about.
That's another good question. So far, we've mostly talked about screening and early detection, but in the event that we do find cancer, the treatment is unbelievable. I can't tell you how much the field has changed in my relatively young career. So I've been out of fellowship for 6 years. And from the time I started my training as a pulmonologist through now 6 full years of practice, it's just completely different. So things that I do, I use actually robotics to do biopsies in the peripheral lung that 9 years ago I would have said this is impossible. But now using robotic-assisted bronchoscopy, we're biopsying lesions that are smaller and further out in the lungs. That's a minimally invasive thing. It's a same-day procedure. I can say surgery has dramatically changed too. So if we diagnose a cancer and we then talk to our thoracic surgery colleagues, what they're able to do now is incredible. It used to be anytime you talked about lung surgery, this is incredibly painful, usually a week at least in the hospital. And now what they're able to do is spare a lot of the lung. They can do a robotic process as well that's minimally invasive, save a lot of good lung, and sometimes have folks out in a day or two.
So is this translating to better survival rates?
Yeah, absolutely. And then I didn't even talk yet about immunotherapy and how chemotherapy has changed, and then advances in radiation oncology as well. So even when we do find cancer, the treatment now is so different than it was 9 years ago, and patients are surviving, they're living longer and thriving.
Remind us what immunotherapy is.
Yeah, so historically, when you think about chemotherapy, we would call it cytotoxic, or it means it kills the cells, right? So that kind of treatment isn't always super targeted. It's going to kill off a lot of cells in the body that just have rapid turnover. And so that's what you think about people just looking kind of wiped out and pale and losing their hair. That's the old school chemo, and we still use that in some cases. But what immunotherapy is we look at specific mutations on the cancer cells, and we see, is there a way we can harness the immune function of the human body to direct and attack the cancer itself. So that's been something that's been really incredible to see.
Yeah, less painful and more effective?
Can be. Absolutely.
Can be.
Yeah.
Well, how exciting is that?
Yeah. So my takeaway message would be, I do think there's a lot of reason for optimism, not just through early detection, but through improvements in treatment as well.
That's great. What happens if I or a loved one are diagnosed with cancer? What can you walk us through the process? For those that are afraid, what if they find something? Okay, what can we expect?
Yeah, it's a journey, and it's a team of providers. So we want to be there at the Cancer Institute in every way we can to support it. We've actually hired a nurse navigator where her only job is to interface with patients that have a new diagnosis of lung cancer. So instead of calling a call center and having a message forwarded on, they get to talk directly to a nurse that has some clinical experience and can counsel them. We have that. We have different support groups for living with lung cancer. And then we have an incredible team, a multidisciplinary team. So we meet every week in what's called Thoracic Tumor Board, and it's just a group of experts that are talking about lung cancer. Every time there's a new case, we present at the tumor board, and everyone weighs in: the surgeons, the pulmonologists, the medical cancer doctors, the radiation cancer doctors, and we come up with a plan together. And we say, maybe this person is eligible for a clinical trial, and here's how I would approach it. And someone else will say, well, what about this? We can offer it to them. So I really like that, working in that part of a group, and it's a team that really takes a lot of pride in doing what we can to help people.
Okay. Can you talk a little bit then about the expertise of the lung cancer team at the WVU Cancer Institute?
I can't say enough. I'm really honored to be a part of that team. But yeah, we've got at every level just wonderful physicians, wonderful support staff, everyone. It's a really great place.
And how much things have changed, even like 5 years ago, right?
Absolutely.
How has that changed?
Yeah, the evolution has been incredible. A lot of my experience in treating and diagnosing cancer was early on. I was always doing these biopsies and then telling people, yeah, it's cancer. It's at a advanced stage, so we're going to treat you, but we're not necessarily talking about cure. We're talking about managing symptoms, trying to give you some extra time with loved ones. And that's been the biggest shift in the last 5 years, is so much of the time we're saying, hey, we caught this early, and we're gonna get you the care you need, and there's a good chance you're going to be cured and have a lot of good years ahead of you.
That's got to be really rewarding.
Yeah, it's incredible.
That's great. So before we go, what's the most important thing you want our viewers or listeners to know about lung cancer?
Yeah, so while lung cancer is a very scary diagnosis and a very major problem, because we've seen so many advancements in our treatment and our ability to detect it early, it's not a hopeless condition. So I would just repeat, for folks age 50 to 80 that have a significant smoking history, if you're not getting screened for lung cancer, ask your provider about it and see, are you eligible? And the odds are we can get you in close to home, either through one of our stationary screening sites or through our mobile program, Lucas.
All right. Well, thank you so much for sharing all this information with us, and we're going to work together to bring the numbers down, right? Or bring the numbers up. Screening numbers up.
Absolutely.
Yeah,
yes.
Yeah, great. Thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about lung and other cancers, visit wvumedicine.org/cancer. And to find the latest episodes and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Chapman and everyone at WVU Medicine, thanks for joining us.